guys, this is Tammy, and Nurse Minder has been requested to do a video on hand hygiene. I guess this, outbreak of coronavirus has everybody wondering just what's the right way to wash your hands. So here I am in my bathroom. I got my studio ready to go, and I'm going to show you how to wash your hands. And I'll give you the 4 moments of hand hygiene, the times when you should definitely be washing your hands so that you're not thinking, oh my God, I just touched that door handle. Do I need to wash my hands? Or, oh my God, I just went into my car. Do I need to wash my hands? So we're going to answer those questions for you today as well. Welcome back. My name is Tammy and this is Nurse Minder, and on this channel we do everything nursing. So if you're new here, consider subscribing below so that you get the next video when it's released. Hi guys, we have been requested to do a video on hand hygiene, and I thought this is probably the best time to do it with the coronavirus making its way into Alberta and people are curious. 20 seconds, 1 minute, what do I do? So if you're in healthcare, first of all, I want to talk to you about the 4 moments of hand hygiene. If you are not in healthcare and you are watching this, these moments are still the same for you. It's just a different language. So let's just look at those 4 moments. Doesn't sound like a lot, but in fact, it pretty much is all the time. So first of all, 4 moments of hand hygiene. The first one in healthcare, or maybe not healthcare, depending on what you do for a living. Before you put on your gloves, you guessed it, hand hygiene. After you take off your gloves, oh, I'm missing the word after here. We're also going to do hand hygiene afterwards. Makes it simple, right? Before and after. Pretty easy. Now, before we come into contact with our patients in the hospital, if you're in the community, before you come into contact with a friend, a neighbor, you're going for coffee, wash your hands. So simple. And you guessed it, after you've left that patient, that person, their room, their house, after the environment, wash your hands. Before and after we're washing our hands. It's a lot of times, right? Okay, now, when you're exposed to bodily fluids, maybe you're caring for somebody and they've just vomited, or you're in the hospital and you're more likely to come into contact with blood, urine, feces, those kind of things. I mean, let's face it, shit happens, right? Pun intended. Now, you would think I'm going to check mark here before exposure to fluids. This often happens without us knowing it, but if we have done it before we put our gloves on, if we have washed our hands before we came into the room, we're already covered for the before. So what's more critical here now is after you are exposed, you want to wash your hands. Absolutely, with water and soap. I don't imagine anybody out there thinking, I'm not washing my hands. I want to keep this feces forever. No. Okay, so that's pretty no-brainer, right? You don't want that stuff on your hands. And then in hospital, and maybe even at home, you're caring for a loved one and you have to do a dressing change. Or a lot of people go home and they're doing their own catheter care. We want to make sure we're washing our hands before an aseptic procedure. So we don't want to introduce any more microorganisms into the body. We want to actually protect and use our natural defenses. So washing our hands will help minimize the risk of microbes entering the body when they shouldn't. And guess what? After as well. It's pretty much wash your hands, wash your hands, wash your hands. Okay, I'm going to show you next the process that you can use and the timelines that we're looking for washing hands. First thing we need to do is remove our watch because we're going to want to access our wrists in part of the hand hygiene protocol. Turning on the tap and getting a safe temperature for your hands, then allow yourself to take 1 or 2 pumps of soap. Now the target timeline we're looking for here is a minimum of 20 seconds. Anything less than that and the research shows that you will still have fairly contaminated hands. Starting with the wrists and getting a nice lather, we're going to move our way down the hands and we're going to put some nice friction in there to help agitate and remove any microbes. You want to focus on the web spaces between each finger, and then you want to also wash each individual finger separately. Now when it comes to the nail beds, we can do a little extra work there and rub them into the palm of our hands using some friction to remove more of the microbes. You can also clean underneath your nail beds at this time. Rinsing from the wrist down towards the fingers, we want to then remove all of the soap from our hands before we pat dry them with a clean paper towel. Now, of note, if you fold your paper towel in two, it is more absorbent than if you use a single ply. Once our fingers and our hands are patted dry, we will then discard our used paper towel, grab a new one to turn off the tap. And voila, your hands are clean. There you have it. 20 seconds is all you need. If you're going to use the hand sanitizer, the pump, absolutely fine. Just make sure you're using 1 or 2 pumps again and rub that all into your hands and let it air dry. Don't let it come off. Until next time, guys, make it a safe and great day. And give you some reasons and tips and give you the hand hygiene moments when we should be brushing our